Imagine a threat that could strike anyone, anytime, without warning. A silent predator, it lurks in the shadows, ready to pounce. What if that threat was a stroke? A stroke is not something that only happens to others. It's a silent threat that could impact any one of us. It does not discriminate, affecting people of all ages and walks of life, taking us by surprise. When blood flow to an area of the brain is cut off, brain cells are deprived of oxygen and begin to die. When brain cells die during a stroke, abilities controlled by that area of the brain are lost. These abilities can include speech, movement, and memory. How a person is affected by their stroke depends on where the stroke occurs in the brain and how much the brain is damaged. Did you know that 4 out of every 10 people who suffer a transient ischemic attack, a mini stroke, will go on to experience a full-blown stroke? It is a sobering statistic, highlighting the urgency of understanding and recognizing the warning signs of a stroke. By the end of this video, you won't have to imagine this silent threat. You'll know exactly what to look out for. So, what is this silent threat when something isn't quite right? And when it comes to a stroke, these signs can be the difference between swift treatment and lasting damage, even life and death. Let's dive into the first 5 warning signs of a stroke. The first sign to look out for is facial drooping. This can be a sudden droop on one side of the face, making the person look uneven. It might make it difficult for them to smile, and their eye may droop as well. The second sign is arm weakness. One arm might feel heavy, numb, or weak. The person might have trouble lifting it, or it might drift downwards when they try to hold it out straight. Third, speech difficulties. This can be slurred speech or trouble speaking at all. They might struggle to understand what others are saying, or others might find it hard to understand them. The fourth sign is time to call emergency services. Time is of the essence in a stroke situation. If you notice any of these signs, don't wait to see if they get better on their own. Call for medical help immediately. The fifth sign can be a bit more elusive. It's a severe headache, often described as the worst headache of their life. It can come on suddenly, without any known cause. These signs might seem simple, but they could be the key to saving a life. So, let's not treat them lightly. Stay tuned as we delve into the next set of warning signs in the following scene. Remember, knowledge is power, and in this case, it might just be the power to save a life. But the signs do not stop there. There's more to look out for. Our journey into the warning signs of a stroke continues. Now let's delve into more manifestations to watch for, as they could be signaling a silent threat lurking within. Another potential red flag is speech difficulties. You may notice someone struggling to form words, slurring their speech, or unable to understand what you're saying. This could be a sign that a stroke is occurring, as it often affects areas of the brain responsible for language. Next, we move on to a symptom that is rather hard to ignore: a severe headache. This isn't your typical run-of-the-mill headache. It's a sudden and severe pain in your head that you can't explain. It can come without warning and doesn't seem to be triggered by anything in particular. This could be a sign that something is seriously wrong. But the warnings don't stop there. Another important sign to look for is numbness. This is often felt on one side of the body and can affect the face, arm, or leg. It's like that feeling when your foot falls asleep, but it's occurring without any apparent reason. This could be another signal that a stroke is imminent. Furthermore, confusion is another warning sign to keep in mind. If someone suddenly seems disoriented, confused, or has trouble understanding simple instructions, it may be a sign that their brain isn't getting the blood it needs. Lastly, but certainly not least, is vision problems. This could manifest as blurred vision, double vision, or even loss of vision in one or both eyes. Again, this is not something to brush off lightly, as it could be an early warning sign of a stroke. Recognizing these signs could be the difference between life and death. So let's not ignore them. Let's be vigilant, for ourselves and for our loved ones. Knowing the signs is one thing, but knowing when to act is another. When it comes to strokes, immediate action can mean the difference between long-term damage and a full recovery. It's important to understand that strokes are medical emergencies, and they require urgent attention. Strokes occur when the blood supply to part of your brain is interrupted or reduced, depriving brain cells of oxygen and nutrients. Within minutes, brain cells begin to die. This is why time is crucial. The sooner you get help, the higher your chances are for a successful recovery. One key thing to remember is that stroke symptoms can vary in intensity. You might experience a severe headache or have trouble speaking. Alternatively, you might only feel a slight numbness in one part of your body. In any case, these are all signs that you need to seek medical help immediately. Sometimes these symptoms might disappear after a few minutes. This could be a sign of a transient ischemic attack or a TIA, often referred to as a mini-stroke. Even if the symptoms go away, it's crucial to get medical help. TIAs are often a warning sign that a more serious stroke could be on the horizon. Treatment for stroke aims to restore blood supply to the brain as quickly as possible, and this could involve medication or surgical procedures. The faster you get treatment, the better your chances are of minimizing brain damage and potential complications. Remember, strokes are a serious condition, and they require immediate action. Don't wait to see if symptoms go away or get better on their own. When you notice any signs of a stroke, it's time to act. When it comes to a stroke, time is of the essence. Prevention is better than cure, especially when it comes to a stroke. The threat of a stroke looms over us like a silent predator, but we're not helpless. There are actions we can take to reduce our risk. Let's talk about lifestyle changes. Firstly, a healthy diet is key. What we feed our bodies directly impacts our health. Consuming a diet rich in fruits, vegetables, lean proteins, whole grains, and low-fat dairy can help lower your risk of stroke. Next, let's not forget about regular exercise. It's not just about looking good, it's about keeping our bodies in top shape. Regular physical activity can help maintain a healthy weight, lower cholesterol levels, and keep blood pressure in check, thus reducing the risk of stroke. But it's not just about diet and exercise. Limiting alcohol consumption, avoiding smoking, and managing stress are also crucial in stroke prevention. And of course, regular checkups with your physician can help detect potential health issues early. Remember, your health is in your hands. Let's quickly recap the key points we have covered today. We began by uncovering the silent threat that is a stroke, an interruption of blood supply to the brain that can lead to severe consequences. We delved into the warning signs, from facial drooping and arm weakness to speech difficulties. We also stressed the importance of time in this scenario. The quicker you call emergency services, the better. Remember, symptoms like headaches and numbness may occur even days before the actual stroke, so don't ignore them. Seek help, even if symptoms seem to disappear. The treatment revolves around restoring the blood supply to the brain, which could involve medication or surgical procedures, and the sooner it's done, the better the chances of a successful recovery. We also emphasize the role of a healthy lifestyle in stroke prevention. High blood pressure and cholesterol levels can be managed, reducing the risk of a stroke. Stay vigilant, stay informed, and remember, knowing the signs of a stroke can save a life.